What if the blood vessels inside your lungs developed dangerously high pressure, and your heart had to work harder with every single heartbeat? You might feel tired, you might become short of breath walking upstairs, and at first, you might think you're simply out of shape. But sometimes, these symptoms can be connected to a serious condition called pulmonary hypertension. So what exactly happens inside your heart and lungs? What causes it, and can it be treated? Let's find out. Welcome back to Heart Lifelines. Today, we're talking about pulmonary hypertension, a condition involving high blood pressure in the arteries that carry blood through the lungs. Although the name sounds like ordinary high blood pressure, pulmonary hypertension is different. It affects the blood vessels between the heart and lungs, and over time, it can place significant strain on the heart. What is pulmonary hypertension? To understand pulmonary hypertension, let's first look at how blood normally travels. The right side of your heart pumps blood that is low in oxygen toward your lungs. Inside the lungs, that blood picks up oxygen. It then travels back to the left side of the heart, which pumps it throughout the body. Normally, blood can move relatively easily through the arteries of the lungs. But with pulmonary hypertension, the arteries in the lungs can become narrowed, stiffened, or damaged. This increases resistance to blood flow. Now the right side of the heart has to push harder to move blood through the lungs. Imagine trying to push water through a pipe that has become narrow. The pump has to work harder. The same basic principle can happen inside the heart. Over time, the right side of the heart can become enlarged or weakened. What causes pulmonary hypertension? Pulmonary hypertension isn't caused by just one condition. There are several different types and causes. It can sometimes be related to changes in the pulmonary arteries themselves. It can also develop because of left-sided heart disease, where pressure backs up toward the lungs. Certain lung diseases, such as chronic lung conditions, can also contribute. Another possible cause is chronic blood clots in the lungs. Some people have pulmonary hypertension associated with congenital heart disease or certain autoimmune and other medical conditions. And in some cases, doctors may not find an obvious cause. Because the causes are so different, determining the underlying reason is an important part of diagnosis and treatment. Symptoms. One of the challenges with pulmonary hypertension is that its early symptoms can be easy to overlook. The most common symptom is shortness of breath. At first, you might notice it only when exercising. Later, even normal daily activities may become difficult. Other symptoms can include fatigue, dizziness or lightheadedness, heart palpitations, chest discomfort, swelling in the legs, ankles, or feet, and in more advanced cases, some people may experience fainting, particularly during physical activity. These symptoms can have many different causes, so having one of them doesn't automatically mean you have pulmonary hypertension. But persistent or worsening symptoms deserve medical evaluation. Why can it be serious? If pulmonary hypertension becomes severe, the right side of the heart may struggle to keep pumping against the high pressure. This can eventually lead to right-sided heart failure. The body may retain fluid, causing swelling in the legs and abdomen. People may also become increasingly short of breath and have difficulty performing everyday activities. That's why early diagnosis and appropriate treatment are so important. The earlier doctors identify what's causing the pulmonary hypertension, the sooner they can begin addressing the problem. How is it diagnosed? Doctors may use several tests to investigate pulmonary hypertension. These can include electrocardiogram, or ECG echocardiogram, which uses ultrasound to look at the heart. Chest imaging, lung function tests, blood tests. In some cases, doctors may perform a procedure called right heart catheterization to directly measure pressures inside the heart and pulmonary arteries. Treatment depends heavily on the type and underlying cause of pulmonary hypertension. Some people may receive medications specifically designed to lower pressure in the pulmonary arteries. Doctors may also treat the underlying heart or lung condition contributing to the problem. Other treatments can include oxygen therapy, medications to control fluid buildup, or procedures for certain types of chronic blood clots. Because pulmonary hypertension can be complex, treatment is usually personalized. Pulmonary hypertension may begin with something as simple as getting unusually short of breath. But behind that symptom could be increased pressure putting strain on the heart and lungs. Your heart and lungs work together every second of every day. Understanding how they work is one of the first steps toward protecting them. Thank you for watching Heart Lifelines.